This is about the health insurance companies, so I think I should title this Dear Insurance/pharmaceutical companies. In 2018, $3.4 billion was spent lobbying. $3.4 billion. That's an all-time high. The industry that far exceeded other industries was the pharmaceutical and healthcare sector industry, and they spent a whopping $280 million. Pharmaceutical and healthcare product sector, that includes the insurance companies. That is 280 million more reasons not to listen to doctors like me that are key opinion leaders, that publish papers in scientific journals, that lecture all over the world, and that participate in clinical trials, that are dedicated to our specialty, that are on the front lines, that are dealing with the patient rejections every day. From 2018 now to the beginning of 2019, I have patients that were paying $100 to $120 a month for their medications. Now the same insurance companies, some of them want the patients to pay upwards of $3,000 a month for a medication. This madness has to stop. And this lobbying and this money being spent comes at a time where the pharmaceutical industries are trying to be capped for how much they can charge for their different drugs and their different medications. This comes ultimately as no surprise. And unfortunately, it's going to keep getting worse unless the senators and the congressmen and the people that make the decisions hear our little tiny doctors' pleas to help us, to help the hospitals, to help the patients, but most importantly, to help the patients, because we are all patients at some point. The lobbying has not been so significant in our country in the pharmaceutical and healthcare arena since 2010, and we know that was the year that Obamacare was passed. So this is a cautionary tale. We are already down the slippery slope. I hope Congress and the Senate are listening to the little doctors like me. Freedom is never voluntarily given by the oppressor. It must be demanded by the oppressed. That's not my quote. That's a quote from the great Dr. Martin Luther King Jr. This video is called Dear Insurance Company. As a doctor practicing in the United States of America, predominantly in New York, New Jersey, and occasionally in California, I have very strong issues with how the health insurance companies are making such a profit off of the patients, such a profit off of the hospitals and the doctors, and not giving the patients what they need in terms of health care. It should not be for-profit health care. They have made doctors that went to 4 years of college, 4 years of med school, 1 year of internship, 3 to 5 or more years of residency, and sometimes a fellowship. They've made us into providers to lump us in the same category with people that aren't doctors. And my grandmother was a nurse. There's nothing wrong with being a nurse. Quite frankly, I love the PAs I've worked with in my life, particularly my current PA. There's nothing wrong with being a PA. But using the term provider, it should be physician assistant, nurse, nurse anesthetist, nurse assistant, and doctor. It should not be provider. But by using provider, you take some of the level of seriousness and gravitas away from all of us doctors. I find that to be a significant flaw. So let's scroll it back for a second, back to 1988. Insurance companies were making about a 12% profit. Patients were getting the medicines that they needed. Doctors were getting paid, and hospitals were getting paid. Everyone was happy. Managed care came along, and they started looking at what they could do to make more of a profit. I'd like you guys to think about it like you think about the airlines. Flying in coach used to be great, and then they squeezed you, and they squeezed you, and they squeezed you. And that is the same thing that these health insurance companies are doing. So every year, they charge the patients more money. The patients are logically thinking that every year the doctors and the hospitals are making more money. And they're not. So I guess what I'm trying to say is capitalism and greed got a hold of the insurance companies. And they said, let's not put people over profits. Let's put profits over people. Let's put profits over hospitals. Let's put profits definitely over doctors. Doctors, some of the insurance companies define as medical waste, like the fact that they have to pay us anything, in their opinion, is completely wasteful. It's kind of unbelievable. And so when I, as a physician, look every January, which is why I'm shooting this in January, at what the health insurance companies are planning on not paying, this medication isn't covered, this procedure isn't covered, this is being questioned, that being questioned. It's unbelievable to me. Let's look at Medicare for a second. I tend to swing to the liberal side of politics. But when people say Medicare for all, they need to realize that Medicare year after year cuts hospital budgets, cuts doctors' payment, cuts everything to try to stay where they can be providing some services. So with all of those cuts, there's not enough money to go around in the Medicare system, and it becomes a problem. So they bring in auditors. The auditors will look over claims from 2 and 3, sometimes even 4 years ago. Some patients aren't even alive by the time their claims are reviewed. Medicare will send the individual doctor a letter and say, excuse me, we overpaid you by $300, by $50. We overpaid you by $25. Kindly give us the money back or we'll take it out of your next check and go after the patient's estate for the money if they're dead. So you actually have to call patients' kids or the spouse that's left behind and ask them for money because Medicare overpaid. And if anything, doctors nor hospitals have gotten appreciable increases in what they're being paid for the last 15 years. That would be clearly, since this is 2019, since at least 2003. I'm just putting that out there. So what the insurance companies do is they deny coverage. They tell you this isn't covered. This shouldn't be covered. They deny medications and they deny appropriate patient care. I myself, who's published over 50 papers in scientific medical journals, who lectures around the world, who's been on countless TV programs, who's considered a key opinion leader in my field, have been told many times by insurance companies that medication's not necessary for your patient's acne, psoriasis, warts, fungus, eczema, whatever it is that they're talking about. They'll tell me it's not necessary, that I should look towards something else. I've had people explain to me that didn't go to medical school that the drug that I want my patient to have, that I know, because I did go to medical school, is better for them, is not appropriate. They try to argue with me that every generic is the same as every trade drug. Now, some of them, one is just as good as the other. Other times, it's not. But I should be able to decide that, and not your insurance company. It's fascinating to me what they do and how they try to dictate to the doctors what should be done. Since 2015, dermatology medications have been cut tremendously in terms of what insurance companies will cover. For that matter, all medications from all walks of medicine have been cut dramatically in terms of what insurance companies are willing to pay for, what they think is reasonable and customary, and what they consider is not. And so what happens is patients that could benefit from all of the medications and certainly all of the innovation that different pharmaceutical companies are trying to bring about just gets cut. It just gets denied. And then there's co-pays, there's deductibles, there's co-insurance. People don't understand their plans. And so what happens is the patients become frustrated with the doctors and the patients start questioning the doctors, when really what it's about is the insurance companies not wanting to cover things. It's very frustrating, and it sets up a barrier which creates a wall which you don't need at all between you and your doctor, no matter what. So what we need is, we don't need silence from doctors anymore. All of these generic drugs that are suddenly skyrocketing high, it's questionable. These supplies are not in short order, many of them. They're rumored to be in short order, but perhaps that's so some of the generic companies can make more money off of the drugs. Now, everybody used to think that the trade drugs were so expensive, and now the generic drugs have skyrocketed. All of this is preposterous, and the patients wind up suffering. And I'm concerned when I see hospitals close, when I see ERs overstocked, when I see doctors overstressed, when I see patients not getting the care that they want or they deserve. And what winds up happening is everybody then all of a sudden wants to be a dermatologist. So I have friends of mine that are OBGYNs, that are internal medicine doctors, that are proctologists, that are urologists, asking me, how do you do Botox? How do you do filler? What do you think is the best non-invasive fat melting device for me to get? Should I start doing laser hair removal in my practice? I'm not going to do an open heart transplant. And I'm being glib, but with the way the insurance companies are reimbursing us, patients want to see doctors, and they want to see physician assistants for some things, and they want to see nurse practitioners for other things, and they're okay with seeing a myriad of other healthcare professionals as well. But patients want to see doctors, and if we keep being reimbursed the way that we're presently being reimbursed, I'm concerned about the quality of students that will be going into med school. Everybody will just go into money management. And this is something we really need to think about. The way that we have the younger doctors like myself have to take the boards every 10 years, taking the bar is a once in a lifetime thing. Taking the boards every 10 years, it's $10,000 plus a lot of other expenses. It's preposterous. So I think that we need to think about the insurance companies, the fact that they're demanding recertification, the fact that they're demanding that we send them audit notes, that they're demanding that we pre-certify, recertify drugs that were already approved for the patient. If the doctor approves the drug for the patient, that should be enough. And there do need to be some checks and balances. The insurance companies have taken their power, just like Martin Luther King said, and they have become the oppressor. So I hope it's not just me that speaks out, because we have to do something about this insurance company situation before it just gets all washed away. And all anybody wants to do is not treat the health of the patient, but just hurry up and get to the next healthcare report, put it in their EMR system, that's their electronic medical record system, and keep it moving. And that's not what we want. We want eye-to-eye contact, and we want a doctor that knows us. Don't we?